Hello, welcome everyone. We are going to have a discussion on public health ethics. So it is very important that we actually look at this topic because we will find ourselves working in the field of public health, and we will be handling issues to do with interventions uh, and that we basically aim at improving the health of the population. So the decisions that we make on which interventions should we implement, who should be the beneficiaries, and how should we allocate the resources, and things like that. So these are actually very, very important. So for us to basically understand what public health ethics is, it's very important that we look at or we remind ourselves that remind ourselves of what public health is. So public health is a discipline that focuses on protecting, promoting health of populations through community action. So basically the focus is on health outcomes of populations rather than the individual patients who may come to health facilities. So the key point here to note is that public health focuses on improving health outcomes of populations. So we carry out a number of activities to reach to that goal of improving health outcomes. We design public health interventions and even evaluate whether they're effective, efficient. We also allocate resources that resources are available to finance healthcare in the healthcare industry. We do conduct research to improve on our knowledge and even to evaluate public health interventions. We carry out research to be able to come out uh, with the most efficient interventions or even the cost-effective interventions. We carry out activities related to health promotion and education. We also carry out policy implementation and evaluation. So way from the formulation up to the evaluation of policies, public health professionals are involved in that. Public health professionals are also involved in assessing the health status of a population. So we look at the mortalities, we look at the morbidities, and then we also look at other parameters that affect the health outcomes of individuals, such as exposures to environmental toxins. These are very, very important. So public health ethics as a field basically concerns with how ethical principles are used to guide the activities that I've just talked about. So if we are going to carry out a vaccination campaign, what ethical principles are you going to follow? If you're going to have a campaign on distribution of mosquito nets, what are you going to follow? If you have a pandemic that has broken out and you have to institute isolation and quarantine, what ethical issues are you going to follow? Those ethical principles, values, and morals that you're going to follow are going to come from public health ethics. Yeah, so public health ethics has a number of perspectives. And so we have four that we're going to look at. This is to mean that public health ethics has about four dimensions that can form it. Or we can look at it in four aspects. That is professional ethics, which is concerned with how a given professional is supposed to act. So what are their characters and virtues? And then we have the applied ethics, which basically look at the general ethical principles that guide professional practice. And then we have the advocacy ethics, which basically look at the fact that public health professionals will have to take a stand on what ought to be done and how resources ought to be done. That is advocacy ethics. And then critical ethics actually look at questioning the powers that be or the authorities, such that they can actually look at populations which are perhaps marginalized or discriminated against. So the key focus of public health ethics is on population rather than individuals. So this is basically what makes it quite different from medical fields or medical ethics, where we look at the interaction between the physician or a nurse with the patient. For public health, the focus is on the populations rather than the individual patients who come to the health facility. So therefore, the scope of public health ethics is in such a way that for all activities, so the scope of public health ethics is in such a way that it looks at all the activities of public health, which I earlier on alluded to. But in addition to what I perhaps said earlier on, there is a dimension of identifying structural and socioeconomic disparities and also addressing them. This is at the core of public health, in addition to health promotion, reduction of risks, and then also research. So public health ethics is actually very, very important because it allows us to know how to govern the practice of public health. There should be guidelines that govern public health. So if we understand public health ethics, then it means we are going to be in position to provide moral governance to public health practice. And also we are in position to know how we can make decisions on how resources ought to be distributed and also what ought to be done. So we use ethical principles to arrive at ethical decisions in the practice. Sometimes we can be faced with what we call ethical dilemmas. This actually means that we have conflicting situations or values that we are faced with, and therefore the course of action of handling an ethical dilemma can be determined if we actually understand public health ethics. When we conduct research, we apply ethical principles that we actually call research ethics. And this is also part of what we call public health ethics. Professionally, we can conduct ourselves in a professional manner if we understand the basics of public health ethics. Public health ethical principles, I've listed so far here about 7 of them. But there could be other texts which can talk about more. So in here we have beneficency, which is that public health intervention should always be aimed at benefiting the populations, which in this case is improving health outcomes of the population, or reduce suffering or disease burden. So it should be about doing good to the population. Non-maleficency is about not doing something that is harmful to communities or populations. The right for autonomy is concerned with making sure that communities are involved and that they are given appropriate information on whatever intervention that is being implemented, such that they can make an informed choice about whether to participate in the intervention or not. Fairness and equity are basically tenets of justice. Justice means that no one should be singled out from benefiting from public health interventions. So public health interventions should be accessible to each and everyone in an equitable way. Fidelity, which is telling the truth, this is usually associated with being transparent, trustworthy, and accountable. Confidentiality is a principle that relates to the fact that you will have access to personal information, and that you should not spread that information anyhow. That information has to be kept confidential. Responsibility is a principle of public health ethics that concerns with the fact that all interventions or implementation of all interventions should be designed in a responsible, professional manner. We have theories of ethics which are very applicable in public health. The first one is the utilitarianism theory. This theory concerns with the fact that the best course of action that can be undertaken should be one that results into the greater benefit, which in this case, the benefit can be in terms of happiness or pleasure. So if we have a greater number of people who are going to benefit from an intervention, then that intervention has to be carried out. And then the deontological theory concerns with that some actions can be inherently right or wrong, regardless of what happens after or what happens as a result of those actions. Basically, what are the consequences of that action? So this theory looks at the fact that public health interventions should be designed in such a way that the freedoms and rights of individuals have to be respected, even if it may result into sacrificing some potential benefits. Virtual ethics is concerned with the fact that professionals or professional individuals ought to have particular traits, for example, traits of what you can call characters. They should be people who are honest, compassionate, and also fair in whatever they do. So that is the theory, that in everything that you do, you should be able to display honesty, compassion, and fairness. And then care ethics is concerned with the fact that there are people who are vulnerable within our populations, and they actually need to be cared for. Okay, so these people should always be put into our consideration because they're actually under our care. And then the contractualism theory. This theory is concerned with the fact that when you become a professional, you are in a way having what you call a social contract between you and the community that you serve, or the society. And therefore, all the interventions that are implemented at community level should be in a way that you actually respecting the social contract that you have with that community. You might not have signed a real physical contract with them, but given the fact that you're a professional who is supposed to be guiding action, you should know that you have the obligation to do the right thing to the community. The Kantianism theory is another perspective of the different theories that we have in public health ethics. This one is concerned with the fact that people should always do what they want others to do to them. So the thing is that their actions should be universal, or they should be treated as universal. What you want others to do to you is what you should do to others. This Kantian theory tells us some basic things. One is that we should respect others. That is, respect autonomy. And then that the principles that we apply should be applicable to everyone, regardless of their social status, interest, or circumstance. And then the third one is that at all times, people should act in accordance with the moral principles and that they're obliged to do, regardless of the consequences of their actions. So everyone should act in accordance with the moral principles of what ought to be right. And then the importance of reason. The emphasis, the Kantianism theory emphasizes that reasoning is very important in decision. making. So in this case, the importance of reasoning in moral decision making is very key. Consequentialism theory is one which looks at someone's action based on the consequences of their action. What would their action result? So therefore, the action to be determined as whether it is right or wrong is determined by the net balance of either the positive and the negative. So therefore, the hallmark is that the action that you take should be one that results into the maximum positive consequences and minimize the negative consequences. So utilitarianism theory is actually a form of a consequentialism theory, which we say that actions should be geared towards making sure that there is a greater number of people who actually derive pleasure and happiness from an intervention. Egoism is a moral theory that looks at that the action should be based on its ability to promote the self-interest of an individual. Altruism, which is the fact that it is the action that is actually taken should be judged on the ability to promote the well-being of others. So there are individuals who actually criticize the consequentialism theory because they raise issues to the fact that the theory only focuses on consequences with little focus on the actions themselves, whether they're negative or positive. So in public health, we have a lot of concerns of dynamics that influence what we do. And so all things that we will find in our practice. Things like informed consent. And we seek to get permission to be able to carry out intervention. So people should make their own decision on whether they should participate or not. So they have to be provided with all the information they require in order to make that decision. But sometimes we find ourselves in a situation where we actually don't know whether the intervention that we are going to implement is going to be beneficial to the clients or not. Or we actually don't know, we don't have full information on the risks and benefits of a particular intervention. In cases of pandemics, when we conduct contact tracing, we might find ourselves revealing particulars of individuals, and this could be a breach of privacy and confidentiality. So this actually becomes an ethical dilemma. There are cases where we have to force people to do certain things against their will. So this is contradictory to the principle of autonomy, where people have to make their own choices because they're competent people. So if we have forced quarantine, or what we had during COVID, for example, the lockdowns, these are coercive measures. The police has to be involved in making sure that people don't move during lockdown. So this actually becomes an unethical dilemma because it infringes on individual rights, and therefore it is involved the use of force. Health disparities. We all know that people of the lower economic class may actually have poor health outcomes compared to others of the higher economic class. How do you ensure that all people have access to health resources regardless of their socioeconomic class? Or what do you have to do to ensure that the gaps in terms of health disparities are actually reduced? So these are questions that we find ourselves in and that actually need us to address. So if you have an individual who has contracted a contagious disease, you may need to isolate that person. That means that that person may go into isolation against their will. That means that you are applying a principle which involves protecting the public, whereas infringing on an individual's right of movement. And that is what we call public good and individual rights. Paternalism is basically a concept that is concerned with the fact that an individual can act in the best interest of the client, even when the client is objecting. So it is, for example, when you have an action that overrules the action of a competent individual. So a competent individual in this case is a person who is actually with sound mind and is actually an adult. Their decisions can be overturned if the person concerned actually thinks that the decision they are making is not the right one. So if that happens, someone is using the paternalism aspect in making that decision. And there are also ethical issues concerned with addition of fluorine to water, for example. And this has several ethical issues that it raises. If the government, for example, decides to add fluoride to water, it means that this fluoride can be taken as, it is looked at as a medical treatment. And if the government undertakes that action, it means that it has not fully consulted everyone. So that means that you have not respected individual autonomy in that case, and that people have not given their consent to consume water that has fluoride. And then we also may not be aware of the safety concerns, how much should be added to water. So safety and dosage is something that we should be asking about, because having an overdose of fluoride can cause dental problems. And then an issue of equity and access to oral health. Addition of fluoride to water can be looked at as a way of improving health outcomes, especially for those who are in the lower economic class. Yet there could be other mechanisms in which individuals in the lower economic class can actually be provided with alternative oral care instead of addition of fluoride. Addition of fluoride can also have health impacts, and there are also questions on whether this is actually the most effective way to prevent oral conditions. And then we look at aspects to do with, for example, international control of infections such as COVID. When COVID came in, people were restricted from moving from one country to the other. And this therefore means that you are restricting people's rights of movement. And also schools were closed, and we were not well conversant of the impact of the closure of the schools, whether it was actually effective or not. Quarantine was instituted against people's will, and then also vaccination in some cases became mandatory, and people were forced to get vaccinated, or they quit jobs, or they don't receive party services from particular offices. Thank you for listening to me.